Mr. President.
The senator from West Virginia.
Mr. President, I ask that we vitiate the quorum call.
Without objection, so ordered.
Thank you. Thank you, Mr. President. Earlier today, the Senate voted to pass the Omnibus Appropriations Bill for 2017. This bill is a product of bipartisan negotiations and hard work on the part of our Appropriations Committee, of which I'm proud to be a member, and the leadership of both of our parties. I'm encouraged by the overwhelming support for this important legislation that reflects our nation's priorities and funds the government in a responsible way. I'm very pleased, and I can't emphasize this enough, very pleased that the bill includes a bipartisan provision that keeps the promise of lifetime health care benefits for 22,000 coal miners and their families, including 8,500 West Virginians, my home state. Bankruptcies in the coal industry meant that these miners would have lost their critical health coverage at the end of last year. We passed that little short-term extension for 4 months, and it was set to expire this coming week. This appropriations bill provides certainty to these coal mining families. Because of this bill, they will keep the health care that they earned through the years of hard work. I worked closely with my West Virginia colleague, Senator Joe Manchin, as well as our representatives, Representative David McKinley, Evan Jenkins, and Alex Mooney, to get this permanent miners' health care fix included in the bill. I also want to particularly thank our Majority Leader, Senator Mitch McConnell, for his leadership on behalf of the miners in West Virginia and his home state of Kentucky and the rest of Appalachia. And I'd like to also thank my fellow Republican senator from the state of Ohio, Senator Rob Portman, who was a critical champion for those miners as well. But most importantly, I would like to thank the miners from across coal country who came to Washington to advocate for their health care benefits. I met with dozens, probably hundreds, over the course of the years of West Virginia miners in my office over the last several years. Last September, miners came by the thousands to the west front of the Capitol and stood for hours in just excruciatingly hot conditions. These miners and their families put a human face on the issue. They are the reason that we have a successful result today. Many of these miners have shared their stories with me through letters and emails and personal stories and visits, and I wanted to share just a few of their thoughts. Brenda, a coal miner's widow from West Virginia, wrote that continued health care coverage presented a life or death situation for her. She wrote, quote, "I have medical problems which require monthly doctor visits and prescriptions, and I will no longer be able to see my doctors nor afford the prescriptions should our health insurance be taken away." Alfred, a retired West Virginia coal miner, wrote, "We were not giving our health benefits as a gift. We worked hard in the mines every day for a long time, and it was backbreaking year to year." Howard, another retiree, wrote that he worked in West Virginia coal mines for 41 years to earn this promise of health care benefits. William, also a West Virginia miner, wrote that he has had several surgeries, including one on New Year's Day 2017. The possible expiration of health benefits and the thought of temporary benefit extensions left him so worried about whether he would be able to access necessary follow-up medical care from his surgery. After learning that permanent health care would be included in this bill, Giselle wrote, "Tonight I will rest soundly, knowing that we'll be able to afford our medicines." Well, for Brenda, Alfred, William, Howard, Giselle, and thousands of other miners and widows across West Virginia, this bill keeps the promise of lifetime health care. There's more work to be done to protect the pension benefits of our retired miners and to bring jobs back to coal country, to that area that's hit hard by the previous administration's policies. But the permanent health care in this bill is a critical victory for our coal mining families and the communities where they live. I would also like to quote a young man who sent me an email. I met him at a Chick-fil-A on a Saturday, not a Sunday, of course, on a Saturday, and we struck up a little friendship. And the day he learned that this was in the bill, He texted me and he said, "Senator, I met you in the Chick-fil-A. Thank you. You have now secured the benefits for my pawpaw." And I thought it was such a heartfelt message that he sent to me, a new friend of mine who'd been struggling along trying to figure out how to help his grandfather. So there are a number of other important priorities in this bill as well. Mining communities will also be helped by tens of millions of dollars across different agencies to help us retrain our miners who have lost their jobs. This bill also includes a significant investment in new fossil energy research, including carbon capture and sequestration. These funds will help spur the development of new markets for coal to keep coal mining jobs for years to come. The appropriation bill also includes funding increases for rural broadband deployment, something I've been very concerned about, and also continued funding for the Appalachian Regional Commission. Access to broadband is absolutely critical for economic development and improved access to health and education opportunities in our rural communities. And we are sadly underserved. There is much work to be done to bring access to high-speed internet to many communities, but this bill is a positive step. As chairman of the Financial Services General Government Appropriations Subcommittee, I'm glad that we included increased funding for Drug-Free Communities program and the High-Intensity Drug Trafficking program, the HIDTA program. Unfortunately, cascading across this country is a devastating problem of prescription drug abuse, opioid abuse, and heroin addiction. The Labor, Health, and Human Services and Education portion of the bill includes an $800 million increase to combat opioid addiction. This includes $500 million authorized by the 21st Century Cures Act to help states with their response to the crisis. It also gives us a better increase for medically assisted treatment and for the programs outlined by the CARA bill that we passed last summer. In addition to these important treatment resources, we also have funded important enforcement and prevention aspects of the problem as well. $50 million is provided for the Department of Veterans Affairs for opioid and substance abuse, for the treatment of our veterans. This is a real problem on our returning veterans who have addiction issues. These are funds to implement the Jason Simkowski Act that Senator Baldwin and I both introduced. Unfortunately, West Virginia is the epicenter of the opioid crisis that has struck communities across the country. Passage of this appropriations bill will make a difference, a big difference, for people that are struggling to overcome addiction and help our states who are financially strapped and our local communities combat this terrible problem. Another area I think of significance to a lot of people in my state and across the country is an increase in the funding for the National Institutes of Health. There is a $400 million increase for Alzheimer's research, something important to me as I lost both my parents who suffered from Alzheimer's. This terrible disease, we need to find not just treatments, we need to find a cure, and I think NIH is where we're going to find it. There are many other reasons to support this bill. It has additional flood relief for our devastated flood areas. I know the president or the presiding officer has major floods in Louisiana. We had them in West Virginia. We've had them across the country. Just to mention a few other things, pay increase for our troops, which are so important. They're on the front lines. The bill also works on scientific research for our educational institutions, something important to our universities in West Virginia. But most of all, I just wanted to appreciate the bipartisan work by the members of the Appropriations Committees who worked hard to get this bill where we are. It's a responsible bill. It's a common sense bill. It sets our priorities. And today, the fact that we pass it with support from both parties, I believe it will achieve a positive result for our country. Mr. President, I note the absence of a quorum.
And the clerk should call the roll.